So we are talking about booze in this next segment. A new study by Yorkshire Cancer Research has found a fifth of drinkers exceed the NHS weekly guidelines of 14 units, which apparently increases the risk of heart disease and stroke. So an incredibly serious matter. Experts are warning the idea of a tipple the idea that a tipple is good for your health is actually a big myth. Well, let's talk now to Dr. Emeka Okorocha. He's new to Breakfast as one of our doctors. Perhaps you become a resident doctor here.
We'll see.
You work in A&E normally.
I do.
You see, I suppose, then a lot of alcohol-related admissions.
Of course.
Is it a myth, then, that having, drink in moderation can be good for you?
Yeah, it's generally a myth. Like, a lot of people, the big misconception was, if I have a glass of wine a day, low to moderate alcohol use is good for you, but nah, there's no clinical benefit that's good. I think a lot of people think when you say, we recommend drink 14 units of alcohol a week, it's no more than 14 units of alcohol a week. We're not actually saying, if you drink up to this, you should have any clinical benefit for cardiovascular or cerebrovascular disease.
Yeah, because 14 units of alcohol, to me, that's like at least a couple of glasses of wine a night. And I get tipsy after a couple of glasses of wine. So that would mean I'm tipsy 7 days a week, and that's within the limits. And surely if you're tipsy, that's having a
Pretty
negative
much, but you'd be surprised how many people think this is the norm.
Right.
And they're happy to get tipsy every kind of day during the week and be like, okay, well, at least I'm having my couple of units and whatnot. And the alcohol does affect everyone differently. So your tipsy may not be my tipsy, perhaps.
Sure.
But at the same time, what we're recommending is the long-term damage that it's going to cause you is still going to be the same. So what we're seeing in the NHS, especially when it comes down to alcohol, in A&E, I see a lot of alcohol-related cases, and this is usually acute. So people who have gotten drunk and they've done their binge drinking and had all those units at once and come in through alcohol-related injury or acute alcoholism or withdrawal. But the biggest issue in the NHS is actually the chronic diseases that alcohol will lead to, such as stroke, heart attacks, ischemic heart disease, and that's what we're seeing in the Western world. So we're trying to encourage people to not only cut down the alcohol, but limit, go teetotal. Dry January, why not do the dry year?
Right, OK. So, really, I've found dry January, a challenge. And I look forward to having a drink. Would you say that, the repair that my body has gone through in the period of January then will have been significant?
It's significant in a way, but it's only a short time. I think it's more the mental benefits of dry January, right? The physical benefits you're going to see over a long period of time. So if I was to take a blood test or perhaps and see your liver enzymes, you're not going to really see a big change in a month. But however, mentally, you're going to know that you can function without a drink and you can actually go your general week and have a good time without a drink. And so it's basically getting out of that habitual mindset, like, I'm stressed, I need a drink. Yeah. It's more, I'm stressed, let me talk to somebody, let me go outside, let me do something productive.
Put some
nice music on. Yeah. Finding different ways of coping.
OK, I like it. Now, whilst we've got you, we're going to dig into some of the other big health stories doing the rounds. Okay. Everyone talks about the Angelina Jolie gene relating to breast cancer. But there's some suggestion now that this same gene also surprisingly affects men. Yeah,
I'm not sure exactly how she feels about it being the Angelina Jolie gene.
Well, she made it raise awareness.
Yeah, she raised awareness of it. It's the BRCA1 and BRCA2 gene, which have been obviously very known to increase your risk of breast cancer. So she had what we call a double mastectomy. So she had both her breast removed prophylactically and her ovaries, which is an oophorectomy, to limit her risk of having breast cancer and ovarian cancer. But we've seen that these genes, when they're faulty, normally they cause, these genes will cause good cells. When they're faulty, obviously they can lead to cell mutation, which leads to cancer. And we've seen that there's an increase of this in both prostate for men and pancreatic cancer for both men and females. OK, so a big health warning there for gentlemen then. If they've got any concerns, they should try and see their GP. And breast cancer for men as well. So breast cancer for men only makes up about 1% of the main cancers for men in the UK, but it's still important that men every month should be checking their breasts as well for lumps, because it does happen and we do see it.
Yeah, you've heard it here. And just sticking with the theme of men's health then, there's a story doing the rounds in the papers about heart disease being affected by worry and anxiety.
Yeah, well, stress is obviously going to affect heart disease in a number of different ways. So when it comes to stress, it comes to like cortisol release and a number of different physiological things your body goes through when you get stressed, including the constriction of blood vessels. Now, if you're having stress over a longer period of time, this constriction of blood vessels is actually going to cause a demonstration of cardiovascular and cerebrovascular disease. Normally, when we're talking about, long-term disease, we're talking about issues with vasculature, and that's what happens when you have a heart attack or a stroke. So stress, although it can look mental, actually has physiological properties where you can actually have chronic health issues.
Yeah, and do you know what? This is all when it comes down to sort of holistic healthcare, because anyone who's stressed or worried naturally might be wanting a drink to ease and causing greater harm.
It's true. It's all linked.
It's all linked. We've just got to live a cleaner life. Dr. Okorocha, we have to leave it there. I could talk to you all morning, but thank you very much for coming in.